My name is Jessica Stoker, and I'm researching the topic, Does Cultural Competency Affect Patient Compliance? This topic explores the question, in patients from minority cultures, are those who are actively involved in their care with acknowledgement of their cultural traditions by healthcare providers compared to those whose customs are completely ignored, more compliant with treatment, medications, and monitoring after discharge from the facility. According to the Migration Policy Institute, immigrants accounted for 13% of the 316 million U.S. residents. With increasing numbers of people new to the United States and its culture, a large percentage of those individuals will likely need the services of U.S. health care. Modern American culture can be a bewildering thing to those unfamiliar with it, and being ill and hospitalized can add to the confusion. It is important for healthcare facilities to ensure that these patients receive the proper education and translation while acknowledging the traditions of their former culture to help them transition and be more compliant with treatment. Moreover, the United States has a growing minority population. According to Census.gov, the minority population is projected to increase from a current 37% to 57% of the total population by 2060. With so many different cultures and backgrounds, nurses have an increasingly complex job providing care in a manner compatible with their patient's culture and to at the same time ensure patient compliance with treatment. With increased numbers of the population identifying with minority groups, these two subjects are relevant topics for nurses to address. In 2008, over 100 million people, or around 33% of the population, classified themselves as part of an ethnic minority group. In recent years, there has been an increased emphasis on both cultural competency and patient adherence to treatment. Objectives for this paper include answering the questions surrounding the cultural competency issue. How does acknowledging culture affect patient care? Does cultural competency improve patient outcomes? Should nurses seek to more actively meet the cultural needs of their patients? My hopes in researching this topic are to obtain a deeper knowledge and appreciation for cultural competency, as well as tools for use in practice. This paper seeks to answer the question, and patients from minority cultures are those who are actively involved in their care with acknowledgement of their cultural traditions by healthcare providers compared to those whose customs are completely ignored, more compliant with treatment, medications, and monitoring after discharge from the facility. Selection criteria for the articles in the paper included peer-reviewed articles, English language nursing publications within the last 5 years, using databases such as the EBSO host and Academic Search Complete using Galileo. Articles were found with the search terms nursing and cultural competence and compliance. Evidence from multiple sources strongly suggests that increased cultural competency correlates with increased patient compliance and better patient outcomes. Gaston writes, the better the perceived quality of provider communication, the more adherent participants were to a provider's advice and instructions. Better communication with healthcare providers tended to be associated with better adherence to medical self-care. Trust and good communication are pertinent components of culturally competent care. Those patients who believed their providers should acknowledge their culture had higher rates of compliance, reinforcing the data behind improved outcomes in the implementation of culturally competent care. Gaston adds, the goals of a clinical encounter include effective communication, the transfer of information and knowledge, and the creation of an atmosphere of mutual respect by the healthcare provider and the patient that incorporates the patient's culture when developing a plan for treatment. Ingram states patient compliance will increase when the nursing plan of care is more specific to the patient's needs. Meeting these needs includes assessing patients' health literacy using various tools, honing patient education to the level of understanding, attempting to understand each patient's cultures and values as well as views of the healthcare system, approaching differences in culture and beliefs respectfully, incorporating patient values into care, assessing the provider's own beliefs, seeking to gain more knowledge of other cultures, and communicating effectively and sensitively. Ingram also cites evidence that supports the statement that patients belonging to minority groups are more likely to have a lower level of health literacy, as well as the fact that culture and perceptions of healthcare are closely related. Starr and Wallace report further data in favor of culturally competent care. When nurses communicated clearly, allowed clients to voice their concerns, responded seriously to them, and explained assessment results clearly, this led to establishment of trust, resulting in increase in satisfaction with care, higher quality interactions, and adherence to prescribed regimens. Communication is a key component of cultural care. They also add that respect without racial bias from the healthcare provider and being included in decision making correlated with trust, greater satisfaction with, and continuation of care. McClemens and other authors also noticed improved relationships and outcomes among participants in their study when cultural preferences, especially in regard to language, food, and gender, were acknowledged. Yet another study conducted by May and Podia found that patients are more likely to follow treatment recommendations if their cultures, customs, and values were acknowledged while receiving care. They write, most of the respondents described that their patients' adherence had improved after their cultural competency training, with the patients following their appointments and performing exercises with the advised dosage. Moreover, their patients reported higher satisfaction with medical care, and some even highly commended their providers after they had received training. Based on the evidence from the literature, nurses and healthcare organizations can follow several guidelines to improve cultural competency and thus their patient outcomes. Efforts should be made to build trust with patients and to improve communication, as these factors were found to significantly improve cultural care and patient adherence. Allowing patients to actively participate in decisions regarding their health care is more likely to allow them to express their viewpoints and leads to patient satisfaction and higher adherence rates. Gaston notes to optimize care, clinicians should incorporate a cultural competence framework, enhance patient-provider communication, diversify clinical staff, and be attentive to issues related to adherence to treatment. This can be at least partially accomplished through the means of cultural competency training, such as in the study conducted by May and Podia. The study must include the relationship of cultural competency to patient treatment adherence, how cultural factors and beliefs affect patients' views of healthcare regimens and medications, the values held by certain cultures and religions that should be respected by providers, provider self-assessment of cultural views, and how to incorporate patients' culture into their care. To further increase cultural competency, nurses must learn to assess their patients' values as well as their health literacy. This will provide a basis for the plan of care and approach to treating and educating each patient. Communication must be respectful and at a level the patients can understand, and the patient's beliefs must be respected and incorporated into care. To assess a patient's level of understanding and health literacy, providers may use tools such as the Rapid Estimate of Adult Literacy in Medicine or the Short Test of Functional Health Literacy in Adults. In addition, organizations should provide basic education regarding common minority cultures in their areas to prepare their staff for encounters with patients from those populations. Staff training must also include self-assessment of cultural views and biases, and the organization culture should promote a healthy desire to learn about other cultures and their perspectives. Healthcare organizations must also provide adequate language services for patients, as mistranslation and breakdown in communication has the potential to cause harm and compromise patient safety. Every organization must also ensure that patients' wishes regarding the type of food served to them and its manner of preparation is suitable for their culture and religion, as well as allowing patients to decide their preferences regarding the gender of their caregivers. Increasing the cultural competency of staff will clearly benefit patients, as multiple studies have shown its positive effect on patient outcomes and patient compliance. As patient-nurse trust, communication, and relationships improve as a result of mutual respect and understanding, patients and staff will both report increased satisfaction. Healthcare providers who participated in cultural competency training stated that the training had increased their confidence, expanded their thinking, made them more self-reliant, and enhanced their assessment and clinical decision-making skills. The respondent also identified the change in their attitude toward their patients. Therefore, cultural competency provides positive benefits for healthcare personnel and in turn healthcare organizations, as happier, more competent staff and increased patient satisfaction and positive outcomes will also bode well for medical care. Cultural competency training, education regarding building patient relationships and trust, implementation of health literacy assessment tools, providing positive organizational views of cultural competency, providing language services, and meeting patients' needs regarding food and staff gender preferences should be relatively simple to implement and should be successful to maintain for the long term. Cultural competency training was successfully implemented in some facilities with positive outcomes. Those nurses who attempted to administer culturally competent care were rated highly by patients in terms of communication, decision-making, and interpersonal styles. Organizations should be able to implement policies concerning language services and food and staff gender preferences fairly easily, and policies and staff education can be successfully used to promote positive organizational cultural attitudes. Simple measures such as promoting effective communication and implementing health literacy assessment tools can be effective yet straightforward to put into motion in healthcare facilities. Small changes toward cultural competency can cause marked improvement in an organization. In today's rapidly changing healthcare world, with increasing diversity, such change is both vital and rewarding.